Hello, I am Eli Adashi, Professor of Medical Science at Brown University and host of Medscape One-on-One. Joining me today is Dr. Regina Benjamin, the 18th Surgeon General of the United States. Our topic, breastfeeding, now more important than ever. Welcome.
Thank you. Good to be here.
And what a pleasure it is to have you with us again.
Yes. Had a good time last time, so thanks for having me back.
Our pleasure. You have recently issued a call to action in support of breastfeeding. Could you describe the essence of this initiative and the drivers behind it?
Well, basically, as you know, my whole platform is prevention, and this is just another place in my prevention strategy to continue. But breastfeeding used to be more commonplace than it is, and we're finding now, we as clinicians, doctors and nurses, we know the benefits of breastfeeding. We know that as the antibodies are transferred to the baby from the mother, less upper respiratory infections, ear infections, we see less SIDS in babies. And so we know the benefits of that. What we don't seem to talk about a lot is the benefits to the mother. There's less frequency of breast cancer in mothers who breastfeed. The same thing is less ovarian cancer. So we have all these benefits. And so we wonder, why aren't we having more breastfeeding? We know that women will start out, over 75% of the women will start out breastfeeding, but by the time they're 6 months, or they're not breastfeeding anymore, and by the time we've gone to 6 months, it's dropped down to less than 12% to 10%. Something happens in between there, so we wonder what happens. And what we're finding is that our society is not as friendly to breastfeeding for moms who want to breastfeed. And we know that many mothers cannot and choose not to breastfeed and may not want to, but those who want to breastfeed, we need to make it easier for them, make the environment easier. And that's where I say everyone can help with breastfeeding. The grandmothers and the mothers used to breastfeed. Now we don't have that as much. So we need to help educate moms and grandmoms, and we have a number of organizations out there that are in the community that are willing to help the moms, the grandmoms, the fathers to support the mother who wants to breastfeed. Same thing in the workplace. More and more women work today, and so they have to go back to work, but we want them to be able to breastfeed. And so just the jobs and making the workplace more friendly and breastfeeding friendly. We've asked through the Affordable Care Act, just requires a company to simply have provide a clean and private room or place for a mom to breastfeed, other than a bathroom. Just something as simple as that. So those are the main things that we really want to encourage people to help moms who want to breastfeed.
So when we say that breastfeeding is more important now than ever, we mean in part that the emphasis on and perhaps the support of breastfeeding has not been perhaps all that it could be.
And we're finding that we're not making it easy for women to breastfeed, so making it easier. And the most important thing now is to give that support, that we all kind of can chip in and give that support. And as clinicians and healthcare community, we can really be supportive. We know that our patients trust us, and they trust what we say. We can encourage them, and we can start encouraging moms who want to be moms in the future to start thinking about it even before they even get pregnant, to start thinking about breastfeeding, so they'll be in that frame of mind. We can also encourage them by giving that support and talking about the benefits of breastfeeding, but also talking about the things that you don't think about. For example, a mom at our launch had her baby there with her, and she says there's nothing like having that baby there looking and connecting eye to eye. The connection you get with the baby that close it's a connection that you wouldn't get otherwise because you're holding that baby, looking in the eyes. Just that bonding, those sort of things.
In a way, if I were to put words in your mouth, you are asking our viewers who are providers, among other things, to serve as advocates for
Yes.
breastfeeding and really provide whatever support they can.
Support and leadership.
And leadership.
You know, the hospitals, to make hospitals breastfeeding friendly, having lactation centers, places that really, we don't always know how to do it ourselves as doctors and nurses. We might or might not, but we can also learn more ourselves. And we can consult those who are experts. And, you know, breastfeeding is personal. And again, everyone may not want to, but those who want to, we can give them that support.
In the call to action, you actually cite a number of specific steps that families, communities, employers, and healthcare professionals can take to improve breastfeeding rates and increase support for breastfeeding. Could you perhaps describe some of these strategies and what the evidence is that backs them up?
Well, I think there's 18 to 20 of these specific things in the call to action. But first one is the family, having the family be a part of this, because everything starts at home. The family and the community and lactation specialists, these community organizations that are La Leche is very helpful in teaching, because again, moms and aunts and grandmoms used to be the ones where you got the education, where they're not necessarily have breastfed themselves. So we have to bring in the whole community now and bring in organizations and others to help teach and to teach them all. And fathers, to make sure the fathers feel a part of it, because many of the fathers that we talked to said they start to feel left out. The mom is breastfeeding and the baby, and what role do they have? Mm-hmm. And so many of the fathers will now say, well, the mom will pump, and at night he will feed the baby while she gets a chance to sleep with the pumped milk, which is very helpful and helps him engage and be supportive, and it kind of makes them all bond together. Mm-hmm. When we talk about going outside in the community, particularly in the workplace, and that's where making women feel like it's okay to ask for a break, to be able to breastfeed or to pump, and not to feel guilty, particularly hourly wage earners. You know, if you're a cashier or something, to say, I need an extra break, you feel guilty because you need to go and pump. We shouldn't make them feel guilty. They should feel comfortable. And it's a part of life. It's natural. And to be supportive, for their co-workers to be supportive, their employers to be supportive. And again, finding a clean place to work, to be able to, in private place. And that's a simple thing to do. And then when we're talking with our doctors and nurses, that they're supportive and make those referrals when they need. Ask the mom, is she having problems? Is she having problems with the baby latching on? What I understand is simple things like, do you feel like you're making enough milk? And it may be that they just need some water to drink and they're not getting enough hydration. Simple little things.
It seems like this is really a good time to increase the awareness of both providers and communities to the import of breastfeeding, and to reinforce some values we may have perhaps neglected some over the last several years.
Kind of going back to basics. You know,
yes.
And nature is a wonderful thing. She's provided for you to be able to give your baby all the things it needs and to protect yourself at the same time. And we should take advantage of that. And there's nothing wrong with formula, and some people need formula, but it shouldn't be the first option. That give moms the natural option first and encourage them. And if they need to supplement, that's one thing, but at least give them that encouragement. We've also been looking for some celebrities and young stars to kind of make breastfeeding hip again. And so that's going to be important, particularly with the younger generations.
Is that in the making, or?
Well, when I launched this call to action paper, we had a couple of folks there that were fairly younger moms, and Spike Lee's wife was one of the people that's there. She's a writer and a successful woman in her own right, and she talks about how he was very supportive with
Wonderful.
them, and the younger generations know her and look up to her.
Wonderful. Despite progress, breastfeeding, in addition to the issues we discussed, continues to be challenged by elements such as the mandatory discharge from the hospital after 24 hours, giving women relatively little time to learn, to adjust, and to practice, in a sense. Then there is the absence of reimbursement for breast pumps, and the limited, if spotty or if any, coverage for lactation consultants. Can you perhaps discuss the steps taken to address these barriers to the extent that such is possible, and any progress that is being made in those areas?
Yeah, with the 24-hour drive-through deliveries, we used to call them.
Yes.
Back in the 90s, I was very active with the AMA trying to fight against that. And I think we've kind of gotten through to the insurance companies. So many of the insurance companies don't enforce that anymore. And so doctors, particularly OBGYNs and family physicians who deliver babies, really are looking after the mom and what's in her best interest and the baby before they discharge. So hopefully that is improving a little bit. But still, with reimbursements and things, that's still an issue, and we're still trying to get them out of the hospital as soon as we can, but without putting the mother or the baby at risk. With the lactation supplies, just this past week, the IRS has come out with a ruling that the lactation supplies, the pumps, are medical devices and are being covered and can be claimed as, I guess, what do you call it?
A taxable deduction.
Taxable deduction.
Yes.
And so that was a big win for us because we've been trying to get that. And you can use it as taxable deduction and as part of your medical savings accounts and it'll qualify,
right.
which is wonderful. And trying to make sure that insurance companies and others will understand the importance of lactation consultants, because it is you have to learn, and to have that's an expertise just like any other consultant we use. And when we talk about things like obesity, for example, we know that a baby who's exclusively breastfed for the first 6 months of life is less likely to be obese. And so having a lactation consultant to be able to help you with that is important.
One other major barrier that women will encounter when breastfeeding is pain. What practical advice or insight can you share with our viewers who are providers as to how we can address this very real
It is
challenge?
very real. And as a family doctor, I'll tell you, the first thing I did was when it gets to be pretty serious, if there aren't minor things, I refer to a lactation consultant because they seem to know their area of expertise and specialty very well. So that's the first thing I'd say. Know and have on hand and a backup a lactation consultant that you trust and you can refer to. But there are things like, just warm compresses and things that the mom knows you can show her how to things she can do to help the baby latch. There are things to keep from being so sore, timing wise and little, as we used to think of home remedies, but the lactation consultants spend time with them they'll be in their homes. They check on them, they call them, and show them these little tricks of the trade to help. And so that, I think, is really an important role, and I can't stress enough how important lactation consultants are.
What more could we potentially do on the educational front in terms of training for providers of any kind so that they are better prepared to advise their patients about breastfeeding?
There's so many, continuing education things we can do. We can learn a lot more, and to be more comfortable with discussing it and talking with the moms, or with making the referrals, knowing when we need to make the referrals, and understanding that it's sometimes a mom may not tell you the problems she's having. She may just keep it to herself, knowing when to ask, and we can educate ourselves a little bit better on those, because we often took it for granted that this was something that was natural, and oftentimes a mom may be having little problems and staying up at night wondering if the baby's not, we bring him in and we weigh the baby and say the baby hasn't gained but such and such, and then the mom feels guilty because she's not making enough milk. And we, as her doctors and our nurses and clinicians, can say, no, this is normal, but these are the things you can do to improve, and give her support.
It would probably make sense, in addition to continuing medical education, to attempt to inject
Into
this
the curriculum?
issue into the medical school curriculum, perhaps, and inappropriate residency training programs into graduate medical education.
And not just for OBGYNs or for pediatricians, but for family physicians,
Yes.
for primary care any primary care specialist, and for some of the specialists, just so we're aware and kind of understand that this is natural in any specialty, and to have some basic understanding.
Well, thank you so very much for revisiting an issue that almost certainly needed a little nudge, having been perhaps taken for granted, having perhaps been assumed to be a non-issue.
And also knowing that, moms start out wanting to breastfeed, but they just can't continue, and keeping it going. We can help them keep it going.
And with women in the workplace, there's no question that the scene has changed dramatically, and that breastfeeding at home before the mass movement of women into the workplace was a very different challenge than it is now. And so updating an issue that is obviously been with us forever is very useful. And we thank you for taking on that responsibility and sharing it with our
And many
viewers.
people didn't want to talk about it, so I hope they'll continue to talk about it and raise awareness and make women comfortable breastfeeding.
Well, thank you.
Thank you.
you very much. On that note, sincere thanks to Dr. Benjamin and to you, our viewers, for joining Medscape One-on-One. Until next time, I am Eli Adashi.